Good afternoon, everyone, and thank you for being here today and joining us today. We have a pretty heavy slate to share with you today, recent updates in a number of areas. Today, I'm going to begin by making an important announcement at the onset of our press conference today. After careful consideration with the Coronavirus Task Force, which we met this morning, we have decided to issue the following directive for the City of Albany and Dougherty County, Georgia. Until further notice, all church services shall cease immediately. This includes worship services, Bible study, weddings, and the like, with one exception: funeral services, which can be held indoors, but shall be limited to not more than 10 people. Chairman Cohilas and Mayor Boudreau will be issuing a joint executive order to this effect in the coming days. I want to make some announcements about county operations as well. At 5 p.m. today, all county government buildings will close to the public until further notice, with limited access to the Judicial building at 225 Pine Avenue. Judge Lockett will expand on these operations when he comes up in just a bit. County departments, including tax and tag, voter registration, public works, human resources, and administration offices will be staffed and accepting phone calls only. Solid waste will still be open. Contact information for all county departments can be found on the county website at dougherty.ga.us. Many services the public needs to access for the county, such as tax payments and tag renewals, can be completed online through the Dougherty County website tax and tag webpage. The county will embrace the social distancing policy by offering some offices a telework option as needed, as well as limiting employees with one workspace at a time. A detailed press release outlining county operations will be provided at the end of this press conference. Today, we will hear from city and county leaders today. Phoebe Putney Memorial Hospital is here to provide a report. We'll have a report today from Public Health, as well as some comments from Dougherty County School Superintendent Kenneth Dyer. We'll have a judicial update as well. The Chamber of Commerce is here and will be addressing today at this press conference, and we will begin by bringing up Mayor Boudreau for some comments, and at the conclusion of our press conference, before we conclude, Congressman Sanford Bishop of the 1st Congressional District is here and will be making some comments at the end. Mayor Boudreau.
Thank you, Chief. Good afternoon. I want to speak briefly about what the city is doing to address the virus. First, I want to assure everyone that the city will continue to provide the essential services of public safety, garbage collection, and water and electricity. The city has made numerous adjustments with our own employees. I won't go into that because that's not really what the public needs to know. What the public needs to know is we have closed all recreation facilities. That is, I know, unfortunate insofar as school has been suspended. However, we would have the same problem if we opened up these recreational facilities that you would have if school was in session, and that is people in close proximity to one another. We are making adjustments, and we're going to address this in the next few days. The task force is considering various options, including modifying the occupancy of restaurants and bars, adjusting and limiting the hours of operation, and certainly we're cognizant and concerned about independent businesses. We want everyone in the community to continue to support our restaurants, but please consider the options of delivery or takeout. We certainly appreciate Congressman Bishop being here, and we're all looking forward to some federal assistance, because when you look around at small independent businesses and people that work from paycheck to paycheck, we know that a closure of business for 6 to 8 weeks could be devastating. We're certainly cognizant of that, and we want to encourage you to continue to support local businesses. But at the same time, let me tell you, all city facilities are closed to the public. We're going to continue, again, to operate public transit as long as we can, because we know that many people rely on public transit to get to and from places. They have no other options. We're taking special precautions with city buses. We're thoroughly cleaning and sanitizing these buses throughout the day. We're doing the same thing with city facilities, and we encourage the public to do so. All non-essential meetings and gatherings have been postponed or canceled. The City Commission will meet next Tuesday as scheduled. We intend to. It is anticipated that some members of the Commission will participate by video conference. We're asking the public not to come to the meeting. It is available on Facebook and social media. We're asking the public, again, not to come to the meeting. Now, I just want to reiterate this, that I'm not a medical professional, but we need to know these things. And you've heard it, but I want to say it again. Anyone who's 70 years of age or older needs to stay at home unless absolutely necessary. These are the people who are most susceptible to the virus. People who think they may have the symptoms of the virus. We ask you, we implore you, do not go to the emergency room. Phoebe has a hotline. Call that number. Call your personal care physician. Phoebe has a drive-through testing available, but a medical professional needs to make the decision whether or not you need to be tested. Please do not go to the emergency room. You might actually expose others to the virus if you have it, and you might actually expose yourself to the virus if you don't have it. So again, please continue to heed the recommendations from the medical community. Be assured that the city will continue to provide the essential services upon which this community depends. I'll be glad to answer any questions, and we're going to work together. We're going to get through this, and hopefully we'll all stay safe. Thank you.
Thank you, sir. I'd like to bring up now Chairman Christopher Cohilis for some comments. Mr. Chairman.
Thank you, Chief, and thank you, Mayor Dora. I want to especially acknowledge and thank the Mayor for his partnership during this very trying time. It's been very important that the city and the county work together, and our joint task force that he and I have commissioned has done a lot of very good work to make sure that we are as out in front of these developments as humanly possible. We have a very smart group of folks that are within our emergency management agency and also comprised of other local community partners, ranging from the Public Health Department to Phoebe Putney Memorial Hospital. We have a group of folks that meet every single day to discuss this, which is a very, very fluid and dynamic situation. I also want to assure the public that your locally elected leaders are in constant contact with leaders at the local, state, and federal level. I spent yesterday on a phone conference with the governor, getting updates on what the state's plan is. Additionally, I had a phone conference this morning with Senator Loeffler explaining the serious and dynamic situation that we are currently facing. I want to echo Mayor Duro's words in emphasizing how serious this situation is. He and I are currently meeting and consulting and reviewing emergency ordinances that you will likely see enacted over the next couple of days as we consider and weigh the costs and benefits to the public as well as to all of our citizens. We recognize that this is a dynamic process where you cannot be too harsh on any one thing. On one hand, you don't want people going out unnecessarily. On the other hand, however, you still have to support your local businesses. Local businesses have to continue to survive. Additionally, you can't shut down all of local businesses. If you do that, then you're going to cause a major economic meltdown, which is obviously not something either he, nor myself, nor the Chamber of Commerce, nor what is right for this community. We do need you to continue to support local businesses making purchases, but just reconsider the manner in which you go about it. Consider utilizing drive-through, consider utilizing gift cards, consider doing pickup service. Do those things that make sense and limit your exposure. However, going into, if you close down all of the businesses and then drive everyone to grocery stores, then you actually have more people congregating and creating a greater opportunity for the virus to spread. I also agree with Mayor Dura that if you're over the age of 70, please, unless necessary, you need to stay at home. Our consideration with respect to church services, I recognize that this is a very trying time and that people naturally want to congregate at church. We know firsthand that has been the predominant way that this virus has spread, and I want to emphasize it has spread within this community very, very quickly, and we need to take swift action to arrest that growth here in this community. It is not a matter of whether or not the virus is going to have a presence in this community or in the state or across the country. It is. What we have to do is manage its presence so that there is not such a tremendous run on resources that it causes chaos, and that is absolutely what we do not want. So you will see over the next several days and weeks several ordinances that Mayor Dura and myself and the task force are going to be considering. We're looking to best practices from other communities that have already experienced this and that have enacted other legislation in order to address these matters. At the county level, we will continue to provide all essential services to our citizens. We also are utilizing telecommuting for the employees that are capable of doing that. And in my capacity as chairman, I will tell you that I'm having conversations with the Georgia Emergency Management Agency, the Department of Public Health, as well as with our congressional delegation, emphasizing how important our needs are. And I will say this, we know that Daugherty County is going to be one of the top sites for the coronavirus infection. Let me repeat that. We are going to be one of the top sites in the state of Georgia for the rate of, or for per capita coronavirus infections. That is a very real issue. If you're not taking this seriously, do it. Do not congregate unnecessarily. Please heed the words of Chief Scott and respect the ordinances that we will be enacting, because they are designed for your safety, the safety of the public, and the safety of your neighbors. Thank you.
Thank you, Mr. Chairman. I'd like to bring up now representatives from Phoebe Putney Memorial Hospital, and I'll just ask that you come up after each other. I'd like to first bring up Mr. Scott Steiner to bring us up to date, and he'll be followed by Dr. Kitchen. Thank you.
Thank you. Good afternoon. My name is Scott Steiner. It's my privilege to be the president and CEO for Phoebe Putney Health System. Today, I want to start off by thanking our first responders, our EMS teams, our police, our fire departments, and our healthcare workers, those at Phoebe and in other places. These are they're the front lines. They're the tip of the spear, and they sacrifice each and every day. And in times like this, our sheriff's department is another example of that. In times like this, these folks run to where the need is. They don't run away, and our Phoebe family is no different. We have 5,000 incredible employees and doctors who are doing what it takes and not questioning anything, but to take great care of our patients and our community. I also want to thank our community partners, Chairman Kohelis, Mayor Durrow, the commissions, Mike McCoy, Sharon Subadan, Chief Scott. It's these partnerships that allow us to be coordinated and to do what's best for our community. Having Congressman Bishop here is a delight as well. We wish it was under better circumstances. He was just at the hospital talking to our command center folks and hearing about in real time what was happening for the people at Phoebe and in our great community. We've also been in touch with Senator Perdue's office, Senator Loeffler, and Governor Kemp's as well, as they've all been interested and very worried about what's happening here in Southwest Georgia. Our COVID-19 hotline is still up and running. The number, as we've shared, has not changed. It is 9 a.m. to 5 p.m. That's when this is up and running. Yesterday, we screened more than 500 calls, with 101 people being tested out of those more than 500 calls. To date, we've had almost 1,000 calls as of this morning, and more than 150 have been tested. So it's quite busy, and some of those calls are coming from other communities. We've had some from Atlanta, Columbus, and Macon, as those organizations tried to do the same thing. We just remind you that no one should show up at the drive-through testing center. Again, please call this number first. If you show up at the drive-through testing center, you'll be asked to pull to the side and to call this number first. It's not a quick process to test each person. So again, we want to make sure that we're using those resources appropriately. The other item is we want to make sure that employers in the community, we've had a couple employers that have instructed their workers before they come back they need to be tested. Again, we are not testing people that are not showing symptoms, and we would ask employers not to do that. And if you have a question, you're certainly welcome to use the hotline if you've got a concern about your workforce. The first COVID-19 deaths in Southwest Georgia have been reported to the state. This morning, Phoebe received 14 test results, including 13 new positive patients. 2 of those patients who were being cared for in the hospital have died. Our prayers and our thoughts are with their families, as well as all of our other patients, employees, and community members during this tough time. As of noon today, we have 23 positive test results for Southwest Georgia. 8 of those 23 are in the hospital, 13 are at home, 69 patients are in the hospital patients under investigation. So we're waiting on those test results. At Phoebe Sumter in Americus, we have 5 in the hospital waiting on results. At Phoebe Worth in Sylvester, we have 1 in the hospital waiting for results. And we have more than 330 people that are at home waiting for results. So I keep saying waiting for results. We have made the decision to change. Recently, Quest Laboratories has come up online for the East Coast. So Monday at noon, we made the decision to switch to Quest Labs, as we have been struggling with our LabCorp, who was both of them are national laboratories. We have been struggling to get results back. We still have some results, as I mentioned, almost 400 results we're still waiting for. Some of those are more than a week old. So we are looking at options to possibly even retest some patients to send them to Quest, hoping for quicker turnaround times. It is a struggle. We are working every day. We wish we could run these tests ourselves, but that is not possible with the technology today. Those are the 2 laboratories today that have that available. You know, the last thing, and I'll have Dr. Kitchen come up, last thing I wanted to mention, and you heard Chairman Kohelas and Mayor Boudreau say, is we're well prepared. We've been stretched. We've been pushed to our limits in a lot of different ways. But we're well prepared, and we're determined to eradicate this virus from Southwest Georgia. We wish it would happen quickly, but we do have to practice social distancing, to not be with large groups. That will be the best way we can eradicate this virus. Phoebe's working to do all of that. We continue all of our other restrictions for visitors, no elective procedures, and caring for our incredible caregivers. So with that, I'd ask Dr. Kitchen to come up.
Hello, I'm Steve Kitchen, and it is truly my honor and privilege to serve as the Chief Medical Officer for Phoebe Putney Memorial Hospital. And as Mr. Steiner has alluded to, you know, our facility has been receiving an influx of patients with suspected COVID-19 for well over a week at this point. And as we've spoken about the last couple of days, we had a large number of patients for whom test results were still pending. About 11 a.m. this morning, we had a large batch of results that came in. So we received results on 15 patients who tested positive for COVID-19 and 2 patients who tested negative for COVID-19. As we previously had stated, we previously had a total of 8 patients who had tested positive for COVID-19. Out of that 8, 5 were in the hospital, 3 had been discharged and were at home. So with the additional 15 positive tests we received today, that brings that total to a number 23 positive tests that we have had. Out of the 23 patients who have tested positive, 8 are in the hospital at this point. 13 are at home, and unfortunately, we've had 2 deaths that have occurred. I want to emphasize we still have 70 patients who are currently in our facility who are what we call patients under investigation, whom their test results are still pending, and there are over 300 patients who have been tested who are at home and are awaiting the results of their test. So, you know, what I will tell you is this. You know, we've spoken about what our approach has been in terms of mitigating the risk of exposure both to other patients as well as to our workforce, is that we were cohorting COVID-19 patients either positive or pending in one of our intensive care units called the Medical Intensive Care Unit, which is on our 8th floor. We quickly filled that up, and so we looked to one of our alternative intensive care units called the CCU, and now we have about 10 COVID-19 suspect or confirmed patients who are in our coronary care unit as well. So we have roughly about 20 plus patients who are requiring critical care services at this point. For those patients who are not requiring critical care services, we have dedicated the 8th floor of our hospital. The thing about the 8th floor, it has more negative pressure rooms than any other of our acute inpatient facilities. So in terms of, again, mitigating the risk to patients and staff, we're in the best position to provide that there. There's another inpatient unit as well at this point, which is housing several of our suspected or confirmed positive COVID-19 patients. I will tell you, I was making rounds through all of our intensive care units yesterday, our medical intensive care unit, our coronary care unit, and the surgical intensive care unit. And as Mr. Steiner has alluded to, these are people with incredible dedication and resolve who do not run from a crisis, they run to one. And so what I will tell you, their spirits and morale are exceedingly high, but I will tell you, they are tired. You know, it's taxed our facility, it's taxed our personnel, but their commitment in terms of providing the best inpatient care, despite whatever the circumstances may be, has not wavered. So with our leadership team, we're always asking ourselves, what next? You know, from a preparation standpoint, We have to have a first-line contingency plan, a second-line contingency plan, a third-line contingency plan. And so, again, we are in a position, whatever we need to do from the standpoint of the facility or to our staff to respond to the need in our community. Chief, did you want to ask Dr. Ruiz to come up next?
Yes, that would be, I think that would be great in line. So I'd like to bring up Dr. Charles Ruiz, Public Health. And before Dr. Ruiz speaks, I'd like to make one comment. This, by the way, will be the last day for the public to attend our press conferences. We're trying to keep social distancing in mind, and only the press conference participants, media, that will be all that will be allowed in the chamber beginning on tomorrow. So I just did want to make that announcement. Dr. Ruiz?
Thank you, Chief. There are a couple of things that I would like to talk about today, and one of them is testing for COVID-19 virus. Now, testing actually does not take place locally. Currently, the actual testing is done at reference laboratories. Places like LabCorp and Quest have already been mentioned. The CDC is still testing, and the Georgia Public Health Laboratory in Atlanta, they're running the test. They process the specimens, but what is going on locally is the collection of the specimens. And you may have heard us say earlier that one of the issues there is there's a shortage of the kits that we use to collect the specimens. They are collected by using a flexible swab that is inserted into the nose. And then that swab is placed into a test tube that has a particular type of solution in it, and then the cap is put on and it's sent to the reference lab. So we're happy to announce that Public Health will begin a collection of specimens and join Phoebe Putney and other groups in the community. Ours will be done slightly different, though. Ours will not be used quite so broadly, and I would like to explain why. We're going to be focusing on a certain group of people. Now, we want to say from the very start that every life is of value, and we're not choosing this group of people or these groups because we think that as individuals their lives are more valuable than others, but it's because of the role that they play in keeping our community together, and also by virtue of some of these folks being more vulnerable than others. Let me read these categories to you. Per the Department of Public Health and federal guidelines, the people who should be prioritized for testing at these sites will include the following: healthcare workers and other first responders who are critical for caring for our nation during this epidemic and who frequently interact with the vulnerable populations. Also, people working with and caring for vulnerable populations such as long-term care faculty staff, long-term facility staff. And finally, people living in congregate settings where the disease can spread rapidly. So I want to talk a moment about how this will work. It's my understanding that the intention was that every practitioner in the state during the hours last night or this morning was supposed to receive some emailed instructions. And so the way it will work is there's a website, and this is the link, and I've provided this for the media. There's a link that providers can go to, and by clicking on this link, it'll take them to a website where they will enter information about the patient, including their symptoms, and they will be able to identify the category, whether it be a first responder, a healthcare worker, or someone who might work in a long-term care facility and so forth. And then this individual, once it's screened by the state epidemiology office, The person will be assigned a particular number, and then public health locally will be notified, and the patient will be contacted, and an appointment will be set up. We began doing this morning at the Dougherty County Health Department. But again, we're only doing people who have been prior approved, and only people who fall into these categories. These tests will be performed at no charge to the individual. So again, they will need a provider who can go online and pre-register them for the collection of the specimen. We anticipate initially being able to do hopefully about 25 per day, and exclusively in Dougherty County. However, if supplies become more abundant, this will be expanded into other counties in the Southwest Georgia Health District. The other thing that I want to talk about just a minute is the incubation period for COVID-19. Here lately, we've been sort of talking about aspects of this virus that have us most concerned, but I don't think we've talked enough about the incubation period. Although we don't know a lot about the COVID-19 virus, or we don't know as much as we would like to know, the researchers tell us that the incubation period ranges from 2 to 14 days. So once we get this germ into our body, typically we are not immediately symptomatic because it takes several days for the virus to work inside of our body to reproduce. And then typically about 5 to 6 days later, the virus is reproduced to a point where it essentially bursts out of our cells, and then it disseminates around our body. We become symptomatic. The virus can be found shedding in our mucus in our nose and lungs and so forth. But after 16 days, if it has not caused us to become symptomatic, then it will not cause us to become symptomatic. So if you take a look back, if you go back 16 days from in the past, we're talking about around March the 4th. So if a person was exposed to a case of COVID-19 virus in February, and if they have not become ill, they're not going to become ill from that exposure. Even March the 2nd or 3rd, if they were exposed, they are not going to become ill. So I think that's important to say because, as we know, there were people who in February in this community had the disease and perhaps were shedding the virus around the community. So if a person has not been exposed, or if a person was exposed prior to 16 days ago, they're not going to become ill from that exposure. Now, I appreciate it.
Thank you, Dr. Ruiz. I'd like to bring up for some comments now Dougherty County Coroner, Mr. Michael Fowler.
Good afternoon. I'd like to say this is a serious time, and very important time that we come together and work together to combat this virus. I had the opportunity to meet with the funeral directors here in Albany, Georgia. The Department of Public Health asked me to see can we put a protocol together to help stop this virus, because of some of the things that happened came from the funeral home, not from the funeral home per se. The funeral home was not at fault because someone came to the funeral home and had the virus and carried it to different services. But what they wanted to do is come up with a protocol that we can do something to help maintain this virus or keep this virus out of the funeral home. And what we have decided to do is the funeral director said, let's have graveside services. Each one agreed we can have graveside service with family members only. This is not the funeral home putting this out saying that this is something that we said that we got to do collectively together, because most funeral this week, we had over 400 members at one funeral. You can just imagine if one person is affected, they can affect the whole congregation. So what we're doing, we're just saying graveside service only, members only, and also while you're at the graveside, being able to stay 6 feet away from one another. Disinfecting the funeral home, and Many times we have visitation the day before the day of service where family members and friends will come in to view the remains. So we asking the funeral director to have hand sanitizer, gel at the door, that you can help people sanitize their hand as they're walking into the funeral home because they're gonna touch things, and also have someone to be able to sanitize the doors and stuff as people walk out. These are things that we gotta do. Another thing that one of the funeral directors mentioned to me, how about limousine? When families get in limousine, you got 7 family members and you also got the driver of the car. If one family member is in there sneezing, coughing, crying, you can spread that virus in that one car. That's an isolated car. Then that funeral director leave that service and go pick up another family, go to another service. He's transferring that disease to the next family. So what they decided to do, we may have to stop using cars. Family members may have to use their own cars. So, and also another thing to do, we can do live streaming. The ones that are sick and the other friends that love to come to the funeral that will not be able to come, you can live stream. The funeral home have live stream, they have Skype, the different other method that you can use. So we asking you, and also family members, if you're sick, do not come to the funeral. We ask you to do not come to the funeral. So another thing that was going on, as Mr. Sam Allen mentioned yesterday about dressing out. Many family houses now that we are going to, we're dressing out in our Tyvek, masks, goggles, or whatever it takes. Because I had 4 firemen come to me the other night, running up to my car and asking me, do this person have it? Because they went in the house before putting the mask on, and also one of the law enforcement, without putting the mask on. Then we found out when we got inside and did the investigation that that person possibly had it. Now they're in quarantine. So what you're gonna see now when we come to the house, the law enforcement, the EMS, and also myself, if I come to the house, that we're gonna be Tyvek, masks, and gloves. We're not saying that your loved one have the virus, but we just being precautious because they came up to my car and one of the police officers came to my car and said, I got 2 children at home. What I'm gonna do? Do I go home? What do I do? Same thing with the firefighter. What do I do? One of them said I had twins. So this thing is serious. I don't know, if you wouldn't probably have an opportunity to see, like Dr. Kitchen said, on 8th floor, it's like ground zero up there. I mean, it's a world, I mean, it's madhouse up there. So I want to say that this thing is real. They're not wasting their time just talking. This thing is real. So we got to do something to help stop the virus from spreading. But if we don't all come together collectively and just have a few people going on like everything is okay, baby, this is not okay. This thing is serious. If you look at ground zero, when I had the opportunity to go up there the other day when someone died, I mean, it's mad, it's a madhouse. So I'm asking you, as the public, to realize, I know we have compassion for your loved one that died. I know you love social gathering, but I'm trying to say, we gotta do whatever we gotta do now, because I hate for you to go to a funeral with a crowd and next week you find out some of your other family members that came to the funeral not have the virus. So we trying to stop and combat that thing. So I want to say, let's do all we can in doing and working the funerals, and also let's do all we can to help the community and listen to what they're saying, because it's very important. Thank you.
Thank you, Mr. Fowler. I'd like to bring up now for some comments Dougherty County School Superintendent Kenneth Dyer.
Thanks, Chief. Good afternoon. Thank you for inviting me to join the press conference to share information on behalf of the Dougherty County School System. This is an unprecedented event, but we know that this community will pull together like we have in previous events, and rest assured that the Dougherty County School System will do its part. First, we've established an alternate meal delivery plan. Currently, we have 8 routes per high school cluster for a total of 24 routes. We're serving 2 meals a day to our students. You can get details about those meal deliveries on our website. Next, parents and students. It's important to remember these are not days off. These are distance learning days. Instructional packets have been delivered to students in a traditional paper format, as well as online learning is available through Google Voice, Google Classroom, and Edgenuity. We've also added a separate section on our website for instructional resources for parents. You can go to our website and click on the Parent Resources section to get that information. If you have any questions, please contact your teachers through our usual communication means. After hours, it's important to adhere to CDC guidelines on social distancing and maintaining at least 6 feet distance between individuals. Remember, you may not have symptoms, but you may be carriers, and you could impact those who are at risk for severe medical challenges. Also, continue to wash your hands, stay away from people who are sick. It's important to check on your loved ones, but do so via text and phone calls. Regarding instruction, we've had some questions about those who don't have personal computing devices or access to the internet. If you'll remember, early last week, we did a survey asking about access to the internet. Based on those survey results, we made preparations to secure mobile hotspots. We currently have 1,000 on hand, and more are coming. Distribution of personal computing devices and mobile hotspots will begin on Monday, with high school seniors going first. We'll have more details about distributions on our website on Friday. Parents, make sure your contact information is up to date, and make sure you subscribe to our DCSS app for more information. Remember, it's imperative that we do our part. It's critical that students do their instructional works during the day, and please limit social activities at night and adopt the shelter-in-place mentality as we work to flatten the curve of this pandemic. We'll provide more information about spring activities and other events at a later date. We're updating our COVID-19 section of our website daily, along with social media updates, so please check there for the latest information for the Georgia County School System. Please remember also that the district office is closed, so if you need any information, please email us at info@docoschools.org, and we'll route you to the proper department. Thank you very much.
Move now to a judicial update. We have Judge Lockett and Judge Stevens here. I'd like to ask Judge Lockett to come up, and followed by Judge Stevens.
Thank you, Chief, and everybody who's gathered here. I'll get right to it. Yesterday afternoon, I was notified that a person who appeared for jury service and actually served on the jury in a recent criminal trial has tested positive for the coronavirus. The juror was part of a group of 110 potential jurors who reported for jury duty on March 2nd for the murder trial, State versus Jazzy Huff. All 110 of those persons participated in the jury selection process, which began on March 2nd and ended on March 3rd. The juror who tested positive was selected along with 17 others to serve as actual jurors during the trial, and actually served from March 9th through March the 11th. As a result, all 110 potential jurors, together with the clerks, bailiffs, court officers, and others in the courtroom or nearby, may have come within 6 feet of the person who tested positive and may have thereby been exposed. The court has identified and obtained the addresses of all of the members of the jury pool that served during that trial, as well as others. As recommended by the Southwest Region Department of Public Health, after extended discussions concerning this matter, the court is sending out today written notices to all persons who were possibly exposed during this process. That written notice, among other things, will inform those persons of the following. Number one, that possible exposure to the person who tested positive does not mean that you have contracted coronavirus. Two, continue to practice safe habits to protect yourself, such as covering your mouth when you cough or sneeze, disinfecting and cleaning frequently touched surfaces, washing your hands, especially after being in public places, after blowing your nose, coughing, or sneezing, and maintaining proper distance, at least 6 feet from others, especially persons who are sick. Number three, and this is important, self-monitoring. For the next 7 days, those persons should monitor themselves, and if they experience any of the common symptoms of the coronavirus, such as fever, cough, sneezing, shortness of breath, respiratory problems, they should contact their personal physician or other medical provider to have their symptoms evaluated and to get advice whether they should be tested or should call the testing hotline. Number 4, if the persons are 65 or older, and if they have special medical conditions such as lung disease, kidney disease, diabetes, or other types of ailments, that they should understand that they may have been more vulnerable than others, that they should remain at home unless absolutely necessary, and again, they should contact their personal medical provider if they experience any of those symptoms. Number 5, the court does not have the names and addresses of all the persons who may have attended the trial. As interested citizens, spectators, or others, however, all such persons are advised, however, to follow the guidelines I've just presented, as well as others released by the CDC. Number 6, anyone who has any questions regarding the coronavirus precautions to take and any other matter should contact the Southwest Region Department of Public Health, as I'm certainly glad to defer to them for their professional advice and information. Now, regarding court operations, last Friday, as you know, I declared a judicial emergency that suspended all jury trials and other legal proceedings that involve large numbers of persons reporting to the courthouse until April 13th. Some of the proceedings that were suspended included not only trials that involved juries, but grand jury sessions, arraignment, calendar calls, child support court proceedings, and other proceedings that involve large numbers of individuals. The next day, which was actually on Saturday, Chief Justice Harold Melton of the Georgia Supreme Court declared a statewide judicial emergency for the same period of time, and in his declaration, he stated that to the extent feasible, courts should remain open to address essential functions and give priority to those matters that are necessary to protect health, safety, and liberty of individuals, such as criminal court search warrants, arrest warrants, initial appearances, domestic abuse, temporary protective orders and restraining orders, and bond reviews. He also mentions that juvenile court delinquency detention proceedings and hearings and emergency removal matters should also continue to occur. And finally, that mental health commitment hearings should continue. Now, I want to be clear about this. While the Chief Justice declared that to the extent feasible, courts should remain open to address essential functions, he emphasized that courts should do everything they can to limit the risk of exposure by handling only those urgent matters and to do so by telephone or televideo conferencing whenever possible, and avoid personal contact unless absolutely necessary. This means, of course, that in-person court appearances will be the exception rather than the rule, and will be very rare, even when such appearances do occur. The court is working diligently to assess our telephone and video conferencing capability for conducting proceedings that way, and we intend to maximize the use of those technologies. Only when we do not have those technologies available will we consider conducting proceedings with in-person appearances. In those cases, we will require and impose appropriate measures to restrict the possible spread of the virus, such as scheduling matters at different intervals to prevent large gatherings, limiting the number of persons who can be present during such proceedings, and of course, taking witness testimony by telephone or video when that is possible. And even imposing distance restriction for persons who actually appear in the courtroom, again, consistent with the CDC guidelines. As far as physical access to the courthouse itself is concerned, this will be, again, severely restricted. Any person or party who has a matter that such person or party believes to constitute an essential function or an emergency should not come to the courthouse in person to get it addressed. Instead, such person must contact the appropriate court or office of the court by telephone and explain the nature of the matter. The court will decide whether it is an emergency or an essential matter and how it will be handled if it is. Though the court staff may be working off-site, the phones will continue to be monitored. And if no one is available to answer calls from the person or parties, they should leave a detailed message and a telephone number where they can be reached. The staff will be monitoring the phones and relaying the information to the appropriate judge or other officer so that the calls may be returned as soon as practical and arrangements made to address whatever the matter may be. Lawyers who file pleadings and other documents in the clerk's office by e-filing, of course, may continue to do so. However, if they need an actual hearing, they should also contact the judge or the appropriate court officer, discuss the matter by phone with the judge or officer, and then the judge, in his or her discretion, will decide what procedure will be followed in resolving the matter. Finally, on last night, I spoke with Chief Justice Harold Melton of our Supreme Court, and he gave me authorization in light of the situation with our jury pool to extend the Doherty Judicial Circuit emergency order I entered on last Friday for an additional 4 weeks, or until May 18th. And this additional 4 weeks, from 4 to 8, is in accordance with the newly released CDC guidelines. I will amend the declaration that I issued on last Friday to make that extension, and a list of the various proceedings that were pre-scheduled that are counseled by this extension will be provided to the media, affected parties, and to the general public by all available means. Obviously, the situation we're dealing with from the court perspective is changing rapidly. The court will continue to reevaluate our response strategy and make adjustments as are needed. And as opportunity permits, I will continue to appear at future press conferences to provide updates on our court operations. And let me say in parting, the court appreciates the patience, understanding, and cooperation of our citizens and all of the community partners as we continue to face these challenging times. Thank you. Judge Stevenson will come and share the unique perspective of the state court and magistrate courts.
Good afternoon. I'm John Stevenson. I have the honor and privilege of serving as state court judge for Doherty County. The paramount duty of any government is to protect its citizens, and I commend the leaders of Doherty County and the City of Albany for taking necessary steps to try to protect our public. In light of the order issued by Chief Supreme Court Justice Harold Melton and by Chief Judge Willie Lockett of the Doherty Judicial Circuit declaring a judicial emergency in our circuit for the 30-day period beginning as of March 13, which will extend through April 13 unless extended by Judge Lockett, the State Court of Doherty County will not be holding arraignment in room 300 of the Doherty County Courthouse on Friday, March 27, on Friday, April 3, or on Friday, April 10. If you have a date on a traffic citation indicating you're to be in court on one of those dates, do not come. If you received a notice to be in court on one of those dates, do not come. You will not be allowed into the courthouse. You will receive a new notice as to when you should report for your arraignment. That notice will either come from my court or from the State Court Division of the Office of District Attorney. If you're unsure when you should report to court, you can call the State Court Division of the Office of District Attorney at 229-431-3212. Again, that number is 431-3212. If you've received a notice to appear for jury duty or for trial during the weeks of April 6 or April 13 in Doherty State Court, do not come. We will not be having jury trials either of those weeks. You will receive a notice from the court or from the State Court Division of the Office of District Attorney as to when you should report for criminal trials. With regard to civil hearings, if you have a hearing that requires the presentation of evidence or testimony of witnesses, it will be rescheduled for a date after the judicial emergency has expired. If you have a hearing that just involves oral argument or it's a status conference, we will try to handle those by telephone. With regard to magistrate court, I've received a memo from Judge Baxter Howell, the Chief Judge of the Magistrate Court, that Magistrate Court will close its operations to the public until April 13, 2020, or until further order from the Supreme Court of Georgia or the Chief Judge of the Superior Court of the Daugherty Judicial Circuit. Magistrate Court will continue to perform essential operations to include first appearance hearings at the jail, to consider bond for persons arrested in the last 24-hour period, and acceptance of applications for temporary protective orders, as well as being available to the police force for arrest and search warrants. Magistrate Court offices at the jail will be closed until April 13, 2020. The Magistrate Court on the third floor of the Daugherty County Courthouse will be open Monday through Friday from 8:30 a.m. to 5 p.m. with limited staff and one judge until April 13, 2020, or until further order. The court will receive phone calls and open mail, but will not hold hearings, trials, or prepare service of process on any court filings. State court will be manned by one individual every day, so the phone will be manned if anybody needs to call our office. If you have any questions about the status of any of your hearings, please contact my case coordinator, Amy Cox, at 431-2152. Again, that number is 431-2152. Or you can email her at acox@daugherty.ga.us. Now, if you're the victim of domestic violence and you believe you need a temporary protective order, do not try to come to the courthouse first. Please call a representative of Victims Assistance at the District Attorney's Office first, or a representative of Liberty House first, and they will make arrangements to make an appointment with the magistrate on call to be available to determine whether an ex parte temporary protective order should be issued. The full hearings on temporary protective orders likely will be delayed until after the judicial emergency order has been lifted. We apologize for any inconvenience this causes the public, but at this time we must be more concerned with the health of our citizens, and I appreciate the efforts that our leaders are taking. Thank you.
Thank you, Judge Lockett and Judge Stevenson. We'd like to move now to hear from our business community. We have the Chamber of Commerce, Ms. Barbara Rivera Holmes. I'd like to bring you up for a few comments, please.
Good afternoon, everyone. I'm Barbara Rivera Holmes, President and CEO of the Albany Area Chamber of Commerce, and I'm glad to be part of this task force looking at ways and implementing ways in which we can support not just the public health component, but also the economic stability of our community and ultimately of our region. I first want to thank all of our first responders, our medical professionals, and our public partners who have done an incredible job in swiftly, prudently, in taking action to limit the spread of this virus. As you know, we are looking at two major impacts. One is the virus. The second is the economic stability of our community. We are fortunate in Albany to have a diversified economy that is made both of large employers and small businesses within a variety of sectors: manufacturing, food production, financial services, retail, tourism. Nonetheless, the American economy exists off of the backs of small businesses, and I can tell you that our small businesses right now are hurting. So what I want to reiterate and what I want to reinforce to our public is that the Albany area is fundamentally open for business. Our business partners are heeding the recommendations of our public health officials and of our publicly elected officials to ensure the safety of our community, of our workforce. They are making modifications. I encourage you as a business owner to make sure that those are in place. Secondly, I want our businesses to continue to thrive so that ultimately our community can thrive. Businesses are available online. Many of our small business shops have online operations. They have drive-through services, delivery services. They have buy now, pick up later options. They're making modifications to ensure that they are still operational, meeting the needs of our consumers while protecting their workforce and the public health. We are in regular communication with our elected officials and are part of the COVID-19 task force to ensure that when we're making public policy decisions, ordinances, they're also being made with respect to the economic well-being of this community. We will likely see, as Chairman Cohilas and Mayor Doro noted, some ordinances that come out giving clearer guidelines to our establishments about ways to operate that are, again, respectful of the public health while still encouraging commerce. I want to thank, again, all of our partners. The Albany Area Chamber is open for business as well. Our lobby is closed to the public. It has been since Monday. Our staff is fully operational, supporting the business community, working with our members, our large employers, to ensure they have the resources that they need. We're advocating and communicating on behalf of the business community and being a partner in ensuring the public health. You can follow us at albanyga.com, where we're providing regular updates on business resources. Congressman Bishop, thank you so much for all that you're doing and for being with us today. As you know, there is a massive federal relief package before the Congress right now, and so we encourage, to the extent that we can, swift action to ensure that gets to our citizens, our businesses, and our municipalities. We are working with our federal partners and our state partners on legislation and relief. We are working with the Georgia Chamber of Commerce and the U.S. Chamber of Commerce on policy that supports our small business partners. AlbanyGA.com. Call us at 229-434-8700 for information. There's two recent developments that I want to make sure our business owners are aware of. One is the Small Business Administration has made available business recovery and assistance loans to businesses that are severely impacted economically through the COVID-19 spread. Information at sba.gov, also through the chamber at albanyga.com. Georgia Department of Labor has enacted a rule to facilitate unemployment claims for businesses and employees that are impacted. Please look at those resources. I again want to reiterate that Albany is fundamentally open for business. Our businesses are taking the steps to ensure public health within the guidelines and recommendations of our public health partners, and also mitigating any risk and taking the steps to ensure that commerce continues. We cannot have a pandemic and an economic collapse. So thank you for your assistance in ensuring that we remain an economically viable community while we manage a severe public health situation. So thank you. Albany Area Chamber is here for you, and anything that we can do, we will do and have been doing. Appreciate it.
Thank you very much. I'd like to bring up for us some comments before we bring Congressman Bishop up. David Blackwell is here with the Albany-Dougherty County Homeless Coalition. If you would, please come up.
Thank you, Chief. My name is David Blackwell, and I chair the Albany-Dougherty Homeless Coalition. Thank you to the sheriff and the mayor for contacting us this morning. The coalition has a working group, and we've been talking daily since Friday. We recognize we advocate for a difficult part of our community that has zero to no health care, very little hygiene, and so that is a significant challenge for our community. We are working on that daily, also working with the Salvation Army, who is the largest sheltering facility in our community. If you've ever talked to me, you know I struggle with the lack of shelter beds this community of our size has. We have less than 100 beds to shelter any homeless or challenged person on a given night. So we are behind the eight ball with that. We're working with the Salvation Army to establish some quarantine space in their facility in the event our homeless population has to be segregated that way. The coalition is working to improve hygiene amongst our homeless and trying to get information into their hands, and I look forward to probably working with Dr. Ruiz a little bit in public health to address that vulnerable part. Our entire community is vulnerable, and we recognize that, but this part of our population has nowhere to go to shelter in place. So they're typically in the libraries, which are closed now, or in these encampments throughout the community. And I'm available for any questions afterwards. Thank you, Chief.
Of course, we're very honored to have you here with us today in Dougherty County, and I'd like to bring up now U.S. Congressman Sanford Bishop for some remarks. Congressman.
Thank you very much, Chief. I'm very, very encouraged to have listened to the fruits of the efforts of the task force here locally with regard to this tremendous challenge that we're facing with the coronavirus issue. I want to just let you know that as your member of Congress, that I'm doing everything that I can possibly do to support our communities and to support each of the elements of our communities that are working so hard to contain this virus and protect our people. We have several health systems in the 2nd Congressional District. Of course, we've got the Piedmont system, which services Columbus, the Columbus area in the northern part of the 2nd Congressional District. We have the Middle Georgia area serviced by Navison, and of course, we have the Phoebe health system here. I've had the opportunity to spend much of the morning at Phoebe and to spend time at their command center, and we should be very proud of the tremendous job that they are doing, the sacrifices that have been made there, people working 16-hour days for the last 2 weeks in planning and the response to this crisis. Let me just say that in Congress, we are doing our best to provide the resources on short notice, having to make sure that people across the country will be able to respond and to contain the spread of this scourge, which has now taken a death toll almost of 200 people in the state of Georgia. What we did week before last in Congress, we passed several emergency supplemental appropriations bills to make sure that those resources were available. We provided $61 million week before last to the Federal Drug Administration, which is one of the agencies that comes under my subcommittee as I chair the Agriculture, Rural Development, and Federal Drug Administration Subcommittee of the House Appropriations Committee. And we appropriated in the House, and hopefully it will soon become law, $61 million to the FDA for the development and the review of medical countermeasures, devices, therapies, and vaccines to combat the coronavirus. And we wanted to do that because it takes time and it takes resources for that to come about, and we needed to do that immediately, and fortunately that was done on short notice. Secondly, last week, because of the tremendous impact that the social distancing protocol is taking, the cancellation of conferences, sporting events, jobs, we found it necessary to take some additional steps. Many of the families who are impacted with schools closing, with people being laid off, we have, for example, the WIC program for pregnant mothers and mothers with small children who will need nutritious foods. If they're unable to get those foods, of course, we want to make sure that there are resources so that the WIC program will have additional funds so that they can have access to those funds. With schools closing, leaving children without free and reduced price meals for breakfast and for lunch, it has been necessary, and we have taken steps to make sure that our school system, as you heard from the superintendent, will be able to serve those non-congregate meals. They normally are required under the regulations to be served in groups in school cafeterias, but those regulations have been adjusted so that those meals can be served at alternative locations, or they can be allowed to be taken home. We also, with regard to WIC, That was $500 million additional dollars in addition to what is expected to be the normal participation rate. And what is of great importance, and I just was, the homeless presentation brought this home. We provided $400 million additional dollars for the Emergency Food Assistance Program, TFAP, and that is to provide added assistance to our local food banks, because we expect that during this time with layoffs, there will be an additional call on our food banks across the country, and particularly in this community, to be supplied a supply of food for those people who are unable to otherwise have food security. And so $400 million additional dollars will be provided for the emergency food assistance program, $100 million of that for storage and for distribution. Also, we want you to know that I have been in touch with and in constant communication with the governor's office, with the Secretary of Agriculture, with regard to the nutrition programs with the schools, the SNAP program. We've got emergency SNAP that will be funded for those communities. And in addition, we are in Congress doing several additional supplemental emergency appropriations bills dealing with our business community. Not only are our families impacted and our communities impacted by the health consequences of the virus, but the economic well-being of our communities is very, very much threatened. And of course, we are in the process now of developing additional packages that will support our small businesses and our large businesses and the employees who will have their lifestyles impacted by layoffs, other loss of income. So with all of that, I want you to know that the Congress on the federal level is working in coordination and in collaboration with our state level partners as well as the local level to make sure that we can join you as a part of the team in helping our communities combat the virus and to survive and to thrive once this passes over. One of the things that I'm so encouraged by is the fact that in the face of these calamities, these difficult times, that we are coming together, that we're working together across all demographics, across all political boundaries, to make sure that our communities can meet and face this challenge together and successfully combat it. My office is working, we are teleworking, but we are working. Our doors are closed, but our phone lines are open, our emails are open, and all of our staff members in Washington, in Columbus, in Albany, and in Macon are available day in and day out to take your calls, and we have a system in place so that we can be responsive. So if there's anything that we can do, please do not hesitate to reach out to us, and we will respond. Again, I'm encouraged by the team effort, by the task forces that have been put together and that are functioning so very well all across this congressional district, and particularly here in the Dougherty County area. And I thank you for including me in this briefing, because it certainly is very helpful, and I will certainly be in a position to pass this information on to all those with whom I come in contact. So thank you very much, and let us know how we can continue to be of help.
Again, thank you for being here, and thank you for all that you're doing for us, Congressman Bishop. In the future, our press conferences, as I mentioned a moment ago, will be restricted access going forward, but you can watch on Facebook Live. Facebook Live is available, and so you can still watch the press conference there. We're just trying to continue to be mindful of social distancing. Before we move to questions, someone brought to my attention lost their keys or left their keys. I believe they are BMW keys, and if you have lost your keys, please see me. I have them. At this time, we would like to open up for any questions you may have. Phoebe Putney, Mr. Steiner, and Dr. Kitchen had to leave, but Dr. Ruiz is still here, and others that can take some of your questions.
So what are the ages of the people who passed away this morning? What are the ages?
It was in the 60s. We had, right now we still have 4 waiting on the tests, and we have one that was, we had 2 that one was 60, both 60 and 60, in the 60s.
So how many have died in total?
Well, case that I've worked, I have 5. I have 4 waiting on tests, and one came back positive this morning.
So what's the connection with the ones who passed away with the ones that are still, I guess, alive? As far as with the ages, are they all who've been tested positive over 60 and still?
Yeah, the one I had 5 cases that I was.
Mr. Powell, please come up so that we can.
Yesterday, we had 3 cases. One died in the hospital this weekend, and we're waiting on tests from that lab. And we had 2 that we sent to the crime lab. They're on the way back from the crime lab now. And then we had 2 die this morning. Both of them was in their 60s. One was positive, and one we're still waiting on a test for that one also.
Gotcha. And I think my next question would be for the public health representative. As far as inventory, do you guys have the resources that you need? Because I know that we're kind of strict on how we're testing people. But it's like as far as inventory, can you talk a little bit about that?
The materials that are used to collect the specimens that are then sent to test for COVID-19, they continue to be in limited supply. Public Health has placed our own orders, and for instance, we ordered 1,000 or so last week, and we've just gotten a handful. The state Department of Public Health has also ordered some, and we received 27 of those kits this morning. Personal protection equipment remains in a degree of scarcity. Some items are maybe a little bit more easy to obtain than others, but gowns and masks are a little hard to come by. We're not depleted, and I don't think that Phoebe is depleted either, but we're looking around trying to find some everywhere we can, and we are pulling some of those together that can be used in particular by Phoebe. But that again is one of the reasons why we also don't want to test people if there's no real value, because to actually gather the specimens, personal protection equipment has to be worn. And so if we're using that personal protection equipment to gather a specimen in a situation where it really won't provide much benefit, then that's one set of protection that's not available for hospital workers.
Gotcha. And no Phoebe representative is here, right?
They had stepped away.
Okay. Okay. Well, I have a question for them.
Dr. Ruiz, do you know, I know that Phoebe people are gone, do you know how many Phoebe personnel are in quarantine at this point?
No, sir, I'm afraid I don't know.
Do you think that they would probably send doctors from surrounding cities to help for like overworked nurses or doctors?
I'm sorry, can I back up? Were you referring to Phoebe personnel?
Correct.
Yes, I'm sorry, I don't know that. Your question
Do
again?
you think that they will bring doctors from surrounding areas to assist Phoebe employees?
I think that's entirely possible. In times of disaster, staff is often mobilized, and it's very common when we have sort of an isolated event like a hurricane or some other natural event that only affects one portion of the state. Daugherty County has been hit really hard, certainly harder than some other parts of the state. And I would imagine that if we needed nurses or physicians, that we could mobilize some to come in.
Gotcha. And Mr. Fowler, I have one quick question come from a viewer. So the two who passed away this morning, we said that their ages were over 60. Is that correct?
That's correct.
Now, did they have any prior underlying health conditions prior?
Yes, they had some underlying condition, but like I said, the virus was positive in one of them, and we're waiting on a test from the other one. And I want to say to the community, people are dying. That's how serious this is. It's not a game. I know people are being sick and being quarantined, but people are dying. So I want you to take this thing serious and isolate yourself if you need to. But I want to say, do what we got to do. Yes, sir.
Did those people that, I'm so sorry.
I'm going to ask that we conclude, and then we can have some follow-up questions. We'll go ahead and end the press conference, and if you have some follow-up questions specifically judicial or from the chamber, yes, sir, please.
I think one thing the city and the county need to look in terms of, got a call about 25 folks playing a pickup game of basketball. We need to close these parks down, put up some indication, maybe take these goals down, whatever the case may be. Certainly, we don't want 25 folks out there just social distance, and that's the thing. You can't social distance when you're playing basketball. So we need to take those goals down, what have you, so that we can make this a safe community spread. That's how it's going.
Yes, sir. Okay. Our next press conference will be tomorrow at 1 p.m., and that will conclude for the day. Thank you.
We're gonna have to get it down to 30 minutes.
We can.